Yes, absolutely.
She's here to answer questions for parents.
It is a big decision about whether to get a vaccine or not, and then a vaccine for your kids.
Dr. Beth Kasanoff Piper is president of the Dallas County Medical Society, touching on important points: who, what, when, where, and why. The FDA is expected to expand eligibility of Pfizer's COVID-19 vaccine next week. Who would this impact?
The Pfizer vaccine is approved right now for 16 and up, so this would add the ages of 12 to 15.
What is the effectiveness on these young teens?
There are about 2,200 kids in the study. And of the kids that were vaccinated, none of them got COVID. It is the same dosage for this age group, the 12 to 15.
When they get vaccinated, are there side effects?
Some body aches, maybe a little low-grade fever, just some fatigue, maybe a little headache, but definitely nothing out of proportion to what we've seen in other age groups.
Where can children be vaccinated if and when it's approved? Dr. Kasanoff Piper expects hubs, pharmacies, and doctors' offices to distribute the vaccines.
I would absolutely wholeheartedly recommend getting my kids vaccinated.
And finally, why? Why should children get the vaccine if they're at less risk of severe symptoms?
There is concern with some of the variants that they really do have more of an impact on kids. So we want to do everything we can to protect our kids and to protect our family members that are around those kids too.
In Dallas, I'm Tiffany Liu.